Hi guys, it's Michael, and today we are talking about yeast. What is yeast? So many people have dogs and cats that consistently start scratching and won't stop scratching, that has different signs that, they're not a happy camper right now. And so we're here today. I'm bringing on one of my favorite people that I've worked with in the past on our clubhouse meetings back during the pandemic. And her name is Dr. Cristina Modell, and she is a dermatologist in the UK. And so I thought, who better than Christina to come on board with us and actually share her insights on how yeast starts. Where does it start? Where does yeast begin? What affects us? What affects the pets? How can we determine what is yeast? Where do we see if my pet has yeast? What are the signs of yeast? So um, I'm just waiting for her to jump up on stage here. I just want to give a call out to Amanda. Thank you always for being here at 11:11. Look at you. Look at your your timestamp. We all love that. Hey, Serge, Jeannie. Hey. So today's the first day of me relaunching my the Pets Journey. So some of you are following me off of Literary Michael. If you're following me off Literary Michael, be sure to um, switch over to my new channel and then go ahead and follow me there at the Pets Journey, because this is going to be a journey taking you, the pet owner, through the process of being the best pet parent. And so we're going to go ahead and we're going to add Miss Cristina to the stage here, and we're going to introduce her. She's one of my favorite people in the world. And this is what's so beautiful about being able to do these lives is I could be here in Los Angeles and she could be in UK, and we get to have a fun conversation and have a fun friendship. And just, and she's someone that I met during the pandemic. So here, let's go ahead and I'm going to add her to the stage here. Hello, Cristina. How are you?
Hi, Michael. So lovely to see you. Thank you for inviting me. It's such an honor.
Yeah, I'm so excited. I mean, we've been working on this and working on this to get you here. And, I've been trying to like kick myself in the butt to get my new programming going for the new year for the Pet's Journey. And when I started thinking about my guests, now I'm like, okay, who would be no better than Christina? And
Oh,
it's like, and in hand, which is so beautiful, is because like one of our, we've known each other for how many years now? 4 years since the
oh, five
pandemic,
this
right?
year because it was the pandemic. 2020 brought us COVID, but also all the negatives of COVID also had positives, and one of them is obviously meeting you, my dear, as they say here.
Likewise,
So,
likewise. Yeah. So, and for you that are on our channel today that are coming in and you don't know what Clubhouse is, I just want to give a little background to that. Is during the pandemic, there was this application that came up on our phones that was called Clubhouse. And it allowed people like myself, like Christina, like Serge, like anyone that had a podcast or a streamer and they wanted to do live streaming to actually go in and have rooms. And then you have guests, or you just have your own room and you talk about your own subject. And then you have people that would come into your room, just kind of like our followers, like we have here. And they would ask questions. Sometimes we'd open up the board to ask questions, and you can ask us questions, and we'd bring you up on the stage and we'd ask you the question. You'd ask the questions to myself or to the guest, and we just dive deeply into different topics. And the topic that stands out in my heart, and I know stands out to Christina's heart, is our pets, the well-being of our pets. So with all that said, and I got a chance to jump on Clubhouse, meet Dr. Cristina, fall in love with her, and we kind of like trudged through the pandemic together on all our channels, and we did so many shows together. So with that said, I want Cristina, please take a moment, introduce yourself, tell people where you are, tell them what you do and what your journey was to bring you to what you do today.
oh, thank you, Michael. What a wonderful introduction. And I fell in love with you too and all the time that we spent together because, to be honest, after all those months we were just isolating at home, having the opportunity to spend hours, and I mean hours, if not days, in Clubhouse having a chat, and then obviously meeting loads of wonderful people. It was a lifesaver at the time. But we have continued our friendship over the years, and I'm very, very honored that I'm still invited to your shows in what has become a very successful channel. And thank you so much for having me here tonight. So, in terms of who I am, well, I am a veterinarian, and I'm an advanced practitioner in small animal dermatology. So dermatology is the area that I enjoy the most working on when I see my patients in practice. The large majority of my caseload are dermatological patients, and those that suffer obviously from skin disease and ear problems and some funky autoimmune conditions, which obviously are included within the package. And funnily enough, and I didn't tell you this, Michael, until now, yeasts are one of my favorite subjects. I love yeast. Don't ask me why. I love yeast. I think they're wonderful. Not wonderful for the pets to suffer from, but I think they are fancy. They are kind of funky creatures, and so I am delighted that we are actually talking about this subject this evening.
Well, when you say they're fun little creatures, and I'm like, are they house guests that you want to invite to your house?
A bit of a smelly ones, I think, if it were to actually come. But I normally tend to say, whenever you find them together, they're having a yeast party. And people laugh, but it's a good way to actually put the subject forward, and they understand what we're talking about. So, yeah, I quite like my yeasties. Yes.
So when we're talking about yeast, for people that have joined us and are going to be watching this channel, what is yeast in pets? Because I was reading the other day, because we were talking with Serge, and we were talking about different types of yeast, and I'm like, oh, does humans get yeast? And of course, humans get yeast just as well as pets do. And so I was like, wow, look at it. It's kind of like the same thing, the exact same thing. It's that bacteria that just loves the moisture, loves that environment just to breathe. And so, what's the first things, or what are the first things that actually start creating the yeast issues in our pets? When people, like, when they see their pets and their puppies, and they seem like they're all good, happy-go-lucky kids, and they're running around, but slowly you start to see, as they get older, they start to get these different conditions. And I know one is like they start scratching their ears, their eyes may get a little red, and tear spots and little red spots and all that. But where does it begin in a pet?
Right. That's a very good question. So, if you think about skin, a skin, in my opinion, is a skin. And obviously, humans have a skin, or animals are a skin. And the skin is literally a big organ inside the body. And the skin is very, very clever. But to protect itself, skin has various mechanisms to obviously protect itself against the sun rays, protect itself against chemicals, and obviously try to keep the humidity within the skin. But also in the skin surface per se, we all, and I mean all humans and animals, have bacteria, and we've got certain amount of fungus. And yeasts are part of the fungus world. So we all, and again, I'm talking about right now pets in particular, including us as well. We are all animals, believe it or not. But pets do have bacteria and yeasts in their skin, and they live there happily ever after. They have their own function. They are part of the microflora that we have in the skin, and whenever they are thriving in that area, obviously well controlled by the immune system, because that's part of their function of the immune system, they're actually helping to prevent the overgrowth of other types of bacteria and yeast, potentially, and fungus, that they could potentially be more pathogenic to the skin per se and cause more problems. The problem is, whenever we've got an underlying condition that could affect how the immune system responds, or potentially an underlying allergy that could also affect how the skin, the skin barrier per se, what it normally tends to happen is that either because the immune system is a little bit suppressed because of A, B, C, D, or potentially because the skin is inflamed, that could alter those levels. And also, particularly when the skin is inflamed, that is a wonderful place for bacteria and yeast to grow in particular. So this is one of the reasons why whenever we've got pets that suffer from allergic to skin disease, or potentially pets that they have an issue with the sebum projection, the oil projection, those pets actually are more prone to have a yeast overgrowth.
When do you because like you know our product Healthy Paws Herbal Labs, and we have a
Hmm.
formula that works with for yeast, and it's been actually it has actually I was grabbing it here. Um, it's it's become like one of our favorite sellers, and
Hmm.
what we've been finding out is pet parents have been dealing with yeast forever, but they've really never had like a really solid solution versus Western medicine. And sometimes that doesn't seem like it really works as well as it could. And so, what we're finding with our yeast formula is like we have a protocol where people have to use it every single day, twice a day for a minimum of 3 months or
Hmm.
minimum of 1 month up to 3 months, so that we really, because I always and tell me if you think this is a good analogy to use, because this is one I use all the time. So you better say it's
Hmm.
good. No, um, is that it's kind of like athlete's feet in a weird way, because athlete's feet's a form of yeast too, right?
Hmm. Hmm.
Yes. So like when as humans, when we get athlete's feet, that's a form of yeast for us. And it's like if you don't get it, like sometimes you can spray it with the chemicals that you get at the drugstore, that freezing stuff and the icy stuff to help, free, what it does to it just kind of holds it together. I don't know what it does, but it kind of like slowly stops it. But I noticed that the moment you give up on the practice of doing that every day, it will come right back at you. And we see the same thing with our pets with that I had this one client, and we get star reviews on our website, on our products, and all of a sudden one came through, and I always love to talk to people about the reviews, especially when they're low reviews, because we don't get many low reviews. And all of a sudden I got this one low review from this one lady, and she gave us a 1-star review, and I was like, a 1 star,
Wow.
I was like, what is going on here? So I reached out to her. I sent her a really lovely message. I'm like, hey, reach out to me. I would love to talk about your experience, and let's see what we can do to make your pet happier, because my main goal is to make your pet happier. You could leave your 1-star review. I'm not worried about that, but I just want to make sure that your pet's happy, and let's see what broke down. Where did it break down?
Hmm.
And so I was talking to her, and then she was saying to me, she goes, yeah, well, I was giving him every day. And, it wasn't until the very end of the month that I started to see that it worked. And she even wrote this in her review. And I'm like, so it took her
Hmm.
all the way to the end of the month before you start to, see what was going on. You start to see a difference. She goes, yeah. And I go, well, then what did you do? She goes, well, it was a 30 days, so I stopped. And I'm like, well, we don't want you to stop. We just say we want you to definitely get to the 30 days. I'm like, so then I'm like, going, well, we have this other formula. Let me grab this too. Because when it gets really severe, we say, get our itchy scratchy, because these two go hand in hand. The
Hmm.
allergies and all that. And when they have yeast, they're scratching and they're doing all this. And so I said, we have this other formula called itchy scratchy. And I said, as 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 a gift to you, I'm going to send you another bottle of the yeast and another bottle of a bottle of the itchy scratchy, so that we can tackle it from both ways. And we're going to work closely together, and do a schedule that works, and just let's see if we can knock this out for your pet, because your pet's miserable, right?
Hmm.
And she goes, oh, I would love that. I would love that. And so she, we continue to talk, and she was like so surprised that I was gifting it to her. She's like, oh my God, who are you? Why would you do this? I've never had a company be so kind. I'm like, well, the group of people I hang out with, like our care is for the pet. We'll go way and above
Hmm.
for the pet, more so than ourselves sometimes. And so I
Yeah.
said, this is just who we are. This is the team that I work with around the world. We just really care about the pets. We just want to do this. And I just want to make sure if this is going to work, because I feel that it should work, um, let's give it 100% chance. And she goes, great,
Yeah.
great, great. And I said, so the first thing I want you to do is when you get it, unwrap it, get it ready. And then I want you to figure out, and I always ask, because you can put our formulas in food, or you can put the formula directly in their mouth. And so I always make sure that there's only one dog or one pet there, because if there's two and they're putting it in the food, then they're both getting the formula, and the pet that needs it is not getting the full formula.
Hmm.
So she goes, no, he's by himself. He's by himself. And I go, well, how have you been given? She goes, I just give it to him in his mouth. And she goes, he's okay with it. And I'm like, great. Okay. So I want you to do it. Do you give it to him before meals or after meals? She goes, well, I just give it to him in the morning just before I give him breakfast. And I'm like, that's fine. And I said, what do you do in the evening? She goes, the evening? I said, what do you do in the evening? Do you do it before the meal or after the meal? She goes, oh, I don't do it in the evening. And
Um,
I'm like, what? And it just shows you by us having this conversation. If I didn't have this conversation with her, she wasn't following the instructions. She
yeah,
wasn't giving them, she wasn't giving them 2 times a day. So it
yeah,
made sense because usually we see with our formula, like after 2 weeks, you see a difference in our formula with the yeast. And she said she didn't see it to the end of the month. Well, that was kind of like giving it 2 times a day for 15 days instead of 30 days. So there was that equation that really was off for her. And I'm like, okay, so there's the issue. The issue is that it's not working. The issue is mommy didn't follow the instructions. So mommy, this is, I got my ruler out, I'm like, get your knuckle, and so she goes, oh my God. She goes, are you really? We're supposed to do twice a day? I'm like, it's right on the bottle. And she picked up the bottle and she read it. And she's like,
mm,
oh my God, it does, So, it just shows you that 1-star review wasn't even a true review because she really didn't have a chance to really review it because she wasn't doing it right. So we always like to make sure that
yeah,
education's there as well, because yeast is a monster and you have to stay on it and you have to stay on it. And once again, that kind of like from going from a 1-star review and having this incredible conversation, she sent me this incredible letter the other day. She goes, Michael, he's doing so much better and it's already been 2 weeks. So
fabulous. I'm
it's like,
really glad to hear that.
because it really, because, if you don't do it, you have to do it right. You have to do it right. Now, I know, like, I pulled up some pictures here. I just want to see if I could share these here. Let's see if I could see window. Let's see if I could see. Okay. So can you see that, Dr. Christina?
No. Oh, yes, I can see them now. Yes.
Okay. So here's our little dog, yeast infection dogs, and it's in dogs and cats. And this is kind of like a blown up look of a type of yeast that our pets get. And then here in the ears, we say that a lot of times we're like, we want to go ahead and understand yeast hides out throughout the whole body. So one of the biggest
Hmm.
signs that I've learned in finding out with pets is, and I've had pets that have had this and I never knew what it was a smell discharge that's in the ear. Um, is that what's your first go-to to look to see where it's hiding or what's going on with the pet?
Right. Well, whenever we're talking about yeasts, obviously they grow in the skin. But if you think about it, the epithelium inside the ear is a slightly modified skin. So yeast grow inside the ear as much as they could potentially grow in the skin. And again, generally speaking, we find a low number of yeasts or Malassezia pachydermis, which is basically the most common yeast that we find in dogs and cats, particularly dogs. And we've got a low number living in the ear canal without, having any issues and potentially causing any conditions. But whenever we look for yeast, sometimes you've got telltale signs, such as situations in which your dog could potentially be, showing signs of redness at the entrance of the ear canals, or they could be showing signs of irritation. They are itching their ears, they're scratching their head, they're shaking their head. That could potentially be that you could hear, you can smell a really funky smell, I call it. Some people say is a little bit musty. I had a client once describing the smell of yeast as popcorn. I can't quite say it that way, but it's definitely a very peculiar smell, and all those telltale signs can actually indicate the fact that your dog could potentially have a bit of a yeasty overgrowth inside the ear. And certainly, and going back to the subject that you were talking about before, obviously compliance is a very important issue whenever we are trying to deal with these creatures, but also as well tackling the underlying cause, which in this case we're talking about allergies, which is the most common cause for that, is very, very important, because otherwise we are not trying to address the problem, we are putting a plaster on it, if you know what I mean. So, but yeah, this is what we normally will find in the ears when we are talking about the yeasty overgrowth in the ear canals.
Is yeast important in our bodies? Do we need a certain level of yeast? Is that a part of our makeup that it's important that we have yeast in our body, or is it just one of those things that just loves to hang out in our bodies because we have the right vehicle for it and it's really something that we don't need?
I think, obviously, I'm not a microbiologist, but I believe the right quantity of bacteria and yeast on the skin are actually designed to be there. They live with us. We can never say that we are alone, because we've got millions of creatures living inside us and on us. So it's a good thing to remember, you're never alone. But realistically, they are there for a reason. And the reason being is that they're actually helping us to protect ourselves from more pathogen bacteria or more pathogen fungus, in which if they had a clear way to to grow in the skin and thrive, they could potentially be causing much more serious problems. So I believe that they are there for a reason, and they are there just to help us.
And what do you think about with pets with yeast? Because we see that it's in the ears, it's in the folds of the arm, in between their legs, by their genitals, and all these like really where moisture happens to set in for even like for us humans. The same thing with like when we get athlete's feet, the feet are moist, and if you don't dry them off, then it's a perfect haven for yeast to build up there. Um, is there any, do you see any major problems having yeast? Like if a pet's been living with yeast for their whole life and the pet owner thinks, oh, he's just fine, he's happy, and they just want to leave him alone and just let him live his life
Mm.
because he's done. So what do you think? Oh, okay, so there's an answer there. What do you think about that?
Well, I think whenever we've got yeasty overgrowth, and overgrowth per se, it literally means and growth in in bigger quantities. So whenever we've got a yeasty overgrowth, what you normally tend to find is that the sheer amount of yeast are actually causing pruritus, which is the technical word for itchiness. And you normally tend to find that dogs that and cats is less common, because normally they tend to when they develop yeast is for another reasons that they could be more complex. But when it comes to dogs, generally speaking, when we've got yeasty overgrowth, the dog particularly gets itchy. And then you normally tend to find they start licking their feet. Or potentially, if you find overgrowth, for example, in the vulval folds, in our little ladies, they normally tend to find that they're maybe scratching themselves in that area or rubbing their bits the floor and things like that. So it is important that we address this overgrowth. And it's also very, very important that we're trying to tackle the underlying cause. Because generally speaking, whenever you've got a yeasty overgrowth, it's because we've got a dysfunction. And it could be a dysfunction with the skin barrier, or it could be a dysfunction with the immune system. And until we address that issue as well as we possibly can, we are not going to be able to get on top of this overgrowth. In other occasions, some animals also could develop what we call hypersensitivity to the yeast itself. So they actually become allergic to the yeast itself. And what normally
Mm.
tends to happen with those very poor creatures is that they are not just dealing with the fact that might have an underlying cause, a faulty skin barrier, plus less the fact that they've got allergies, is that actually because they're allergic to the yeast itself, very low numbers of yeast can make their life miserable. And that's why obviously attending to your veterinary clinic or your veterinary hospital, and then obviously visiting your veterinarian and ideally referring to a dermatologist can be extremely helpful in these situations. And obviously using a combination of different products and therapies in order to address this issue. And obviously we just talked about your products, particularly they're based on large and extensive knowledge about how herbs can actually help skin conditions. But it's also important sometimes whenever we've got a very severe overgrowth to obviously address that as well with some other types of therapy. And that's why attending or taking your dog to your veterinarian can be really helpful in addressing the acute issue, and then potentially trying to find where's the best way to just continue manage it in the long term.
So when you say that with your veterinarian, like if you like, let's say they start with the veterinarian, they're like, something's going on. They're like, oh, your dog's got yeast. What do they prescribe them?
Well, I think the most important thing, first of all, is that they actually find why or why the pruritus is happening. They have to do certain types of tests to make sure we don't have any other issues, that we don't have any fleas causing this pruritus, that we don't have any bacterial infections. And obviously, we don't have any yeasty overgrowth causing this problem. And there are various techniques that your veterinarian can actually pretty much do at the time of the consultation, and they're obviously going to help them to find, hopefully at that time, um, as well, obviously, forgot to mention ectoparasites such as the maricosis or demodex per se. But those tests can be done pretty much during the first or the second visit to your vet. And realistically, once that we know, again, there are certain ways to treat this. We are in the current Western world, and I'm sure it's in the States the same that is here in Europe, particularly in the UK. We are trying very much to minimize the use of any antibiotic therapy or fungal therapy to address these problems. And we use a lot of topical therapy when we can. So this means the use of certain types of shampoos, and these shampoos could contain some antiseptic products plus less some antifungals. But there are some cases in which the yeasty overgrowth is very, very severe, in which you don't have a choice but using stronger products such as antifungal, systemic antifungal drugs. But obviously, we only use this in extreme cases in which we can't really tackle for A, B, C, D reason the problem that we have topically at that time. But yeah, there's a combination of therapies that they are used to tackle this issue.
Nice, nice, nice. We've got a couple of people in the chat, and I know that one, Jeannie, who's in our chat right now, she's actually, I believe, has her dog on our Yucky Fungus right now, and he is becoming yeast-free, which is so lovely to hear. And she mentions in her chat. Do you see the chat? Can you see the chat yourself,
No,
Christina?
unfortunately, I can't see it. No.
Okay, okay,
Oh, hold on.
okay.
Maybe I can. Yes, I can. I'm lying. Just
You're
click the
lying. No,
wrong key.
no.
I am lying.
Yeah, so she's got three of them. So I'm pulling you on board here, Jeannie. You've got 3 of your dogs. Are they all on yeast right now, Jeannie? We'll see what she says here. Um, and that's my whole goal is like I want to bring education to people. That's what this channel is all about. It's also about your journey. My guests, I always like to listen to the guest journey, like how did you get involved with what you do. But then it's like when we pick a topic like this, I really want to be able to have a conversation that when people go away from this and they watch it and they're like, oh wow, now I understand a little bit more about what's going on with my dog, how they got yeast, how I can actually help them with relieving that yeast, because it is, I see so many dogs sometimes when I first see them, and I never knew what yeast was until I got in the dog world. And now that I'm in dog world, I can spot like a mile away usually. I can see a dog over in a corner by a tree on a park scratching away and licking and all that, and I'm like, oh, that poor dog needs help.
Oh, Michael, I've lost you. Can't hear you very well. I'm sorry. Okay, are we back? Right. Can you hear me? Nope. Not sure what's going on. Okay. Right. I'm gonna move to another location and see if there's an issue with my Wi-Fi here, okay? So I'm just gonna switch my camera off for a moment and then go somewhere else and see if we can get there, okay? Right, let me just try 1 second. Okay, can you hear me now? No, I can't hear you. Oh, I'm glad. I'm Emmeline. Hi. I'm glad that you can hear me. I thought it was me. Unfortunately, I can't comment because I'm not logged in into YouTube. I'm not the most techy person in the world, but I think we've possibly lost Michael. I'm gonna sit here on the stairs. Sorry, the background is not as beautiful, but at least it's better than nothing. Okay. Well, guys, so until we have Michael back, I think we've got a bit of a technical issue. If you can hear me, please write a comment on the chat so I know that we can carry on chatting away while Michael fixes the problem. Can you please do that? Would that be okay? Guys, can you see me? Can you hear me? You've just minused. Oh, fantastic. Fantastic. That's wonderful. Okay. So we're going to let Michael try to fix his problem. I will remain in the stairs just in case. So unfortunately, I can't reply to your comments because I'm not logged in your YouTube. But please feel free. Let's use this time proactively. And if you can think about any questions that you'd like to ask me, please feel free to put a little comment and let's do a little bit of a quick question, quick answer kind of session. Well, Michael fixes the problem. So any questions that you guys have about yeasts that I can answer for you, feel free to fire away. Okay, I think looking at the chat, well, we had Janie DB that actually says that Healthy Paws has made a huge difference. So I'm super, super delighted, Jeannie, because I know Michael products are fantastic. Unfortunately, they are not here in Europe and they are not here in the UK. And I have done a couple of courses in herbal medicine, and I know how useful certain herbs can actually be to deal with skin conditions, chronic skin conditions. So I've been talking to Michael in the past, see if we can find a way to get them here into Europe. It's not as easy as we think it is, but certainly I think they will be in my toolbox if I had the opportunity to use them for the management of my chronic skin patients. Okay, so what are the symptoms of yeast in cats? That's a very good question. Skinny. Right, okay. So yeast are the kind of fungus we talked about that they can live in the skin, but they can also be inside or live inside the hair, the nail folds. So I don't know if you have noticed sometimes whenever you look at your dog's nails, near the nail fold, there is like a greasy kind of brownie discharge. That basically is obviously a secretion that it comes from the nail fold, but potentially if the yeast are actually overgrowing inside the nail fold, a condition that we call paronychia, some of them can be, or that condition could potentially be caused by an overgrowth of yeasts. And this is what we normally tend to find whenever we find cats with yeast, that we've got an overgrowth inside the nail fold. And in some cases, when the immune system is suppressed, and that's what we were talking about before, we find an overgrowth of yeasts in cat skin. So the presentation is similar to a degree, but we normally tend to find a less frequency yeast in cat skin as much as we find it in dogs. So Amy Lane has asked another question, but I hope I answer your question about the yeast in cats. And Amy Lane is asking us if there's a specific food that's better for yeasts in dogs. Very good question, Amy as well. Just because whenever we are talking about yeast overgrowth, as explained before, this could be related to the fact that we've got a potential underlying hypersensitivity. And hypersensitivity is the posh word for allergies. So whenever we are dealing with yeasts and potentially bacterial overgrowth, one always should ask themselves, what is causing that bacterial overgrowth? Do we have an underlying immunomediated problem? Do we have an underlying endocrine problem? But the most common cause is an underlying hypersensitivity. And when it comes to distinguishing what kind of hypersensitivity we have, it's actually very difficult to know if this hypersensitivity is caused by certain types of food or potentially some environmental allergens that are obviously leading to this particular problem. So in answer to your question about what is the best food whenever you've got a yeasty overgrowth, the answer is that the only way for us to find out, it would be to do something that we call a food trial. And this food trial is something that your veterinarian would advise you to do once that they have established that obviously the underlying problem with your particular dog is obviously a yeasty overgrowth, that we don't have any fleas, that we don't have any demodicosis, that we don't have any sarcoptic mange, that we don't have any dermatophytosis. And obviously they've done further tests, some tape strips and things like that in order to find out that we've got yeasty overgrowth. So if the yeasty overgrowth also corresponds to another clinical signs that we find whenever dogs have allergic skin disease, then one of the tests that we will do is to do a food trial, because not all dogs are going to be sensitized or reactive to the same type of proteins or the same type of carbohydrates. So just to kind of recap on your question, I don't think there's a particular type of food that would be designed that not causing any kind of yeast overgrowth at all. But it's also very, very important to make sure that if your pet suffers from a yeasty overgrowth, that we try to find out what the underlying cause is so we can actually address it. I hope I answer your question, Amy Lane. So we've got another one from Janie DB, the feet. I have one that never stops licking her feet, and I think has become a habit. Michael is kind of trying to get in still. Able to could jump in. Licking her feet, and I think it has become a habit due to the yeast infection for so long. Yes and no. Potentially, I think whenever like we do on a regular basis, things that they become, we do it regularly, obviously, to a point, they're part of who we are. Some people actually, I don't know, touch their hair all the time. Some people actually, I don't know, wrap their hands, it becomes a habit. But with animals, one of the clinical signs that we might have some issues is potentially the fact that they keep licking one particular area. Is their way to relieve their itchiness, their pruritus. So if your dog is doing that on a regular basis, although, the yeast product that Michael is having could be extremely helpful in the long-term management, I think it's always a great idea to just pop into your vet and make sure that we don't have any other causes for that problem, and also trying to find what the underlying cause is so we can potentially try to address it, not just trying to address the problem in the superficial aspect of the skin, but trying to address the problem in the inside so we can prevent this happening again. Right, still no Michael, unfortunately, but hopefully we'll jump in any minute. No problem. It's my pleasure, Toll. That's been my pleasure. So we've got Lara asking another question. Our biologist sisters and both have been in my apartment for years. But sisters, but just worried. Again, unfortunately, I can't really comment without assessing them. They are sadly not my patients. I would love to see them for you if I could. If you want to catch a plane and get your paperwork, you're welcome to come and join me in Liverpool, and I will be super, super happy to look at them for you. But if you're worried, the best advice I can give you is take them to your veterinarian. They will do a thorough checkup, and they will obviously check if there is any underlying issue. The fact that they are sisters doesn't necessarily mean that they need to be identical. Some cats particularly are greedier than others. Some cats are lazier than others. So the fact that they are sisters, it doesn't necessarily mean that they're going to have the same levels of activity, and you might find that one of them is a little bit more of a what we call a couch potato versus the other one, which is basically more like an athlete and is running around and is moving around more and burning more calories. So you might be finding that's a simple reason as that, or maybe one of them is a bit greedier than the other, obviously eats more and is not exercising as much, therefore it looks bigger and is putting more weight on because obviously it's not burning it, and the other one is looking after her figure in a better way. So on those bases, again, my best advice to you is to take them to your vet. Here in the UK, we call them vets. I know that you guys call vets, your veterans. But I'm talking about your veterinarian, and hopefully your veterinarian will be able to check them, and as such, try to find a prop. I said, just to give you a peace of mind when it comes to that. Amy, she has environmental allergies as well as a chicken allergy. Okay, so that actually gives me a little bit more information. So if we've got environmental allergies, then that could be the underlying cause for why your little girl is obviously having this recurrent issue. Therefore, it would be a good idea again to discuss with your vet or veterinarian what options we have to manage that condition. There is a way to kind of manage this condition medically, or there is a way to manage this condition using another type of treatment that is called immunotherapy, which basically it helps the immune system to tolerate the allergens in a slightly better way. Plus, less the fact that we've got herbal paws that I think that as a kind of complementary therapy can be really, really useful. But again, I will direct you to speak to your veterinarian, and potentially if referral to a dermatologist is an option, that would be my best advice to you. In regards to the chicken, please don't feed our chicken. That solves the problem nice and quick. So if you avoid, that is what we call an avoidance therapy, if you want, then at least if you don't have that as a potential culprit, it's one less thing to worry about. Still no sound. Yes, I agree. I can't hear Michael either. Unfortunately, I can't even see him. Maybe I'll do a quick feed in my poultry for infections. Running Bear, I think that's actually an interesting comment. And I'm not saying that chicken has become a problem from the point of view that every animal that eats chicken, potentially is going to develop allergies. But my personal observations in the last 20 years I've been doing this job have been that I have found that a quite an important, well, I want to say the large majority, but a good quantity of the patients that I've been treating for food intolerances, chicken is high up then in the list. So, because fortunately for us now, with the amazing commercial diets that we've got available, there are loads of other proteins that we can use. I would say the same that I just said to Amy Lynn. Try to stay away, and at least either you give a little bit of chicken every now and again. It's not going to be the end of the world, but as a rule, there are other proteins that you can feed your dog, so that might be a good option. Right. What else do we have? Oh, Lara, it's my pleasure. I hope I answered your question. We've got another comment. I have 2 English Mastiffs. One has ear problems, and once I found it was her food she was allergic to. Yes or no? Well, I would refer to my previous comments. Unfortunately, as much as I would love to say that it's so black and white, is not as easy as it sounds. I think that's part of the challenge of the discipline that I enjoy working the most. I love dermatology. I think it's a fascinating subject. And what I normally tend to say to my clients is whenever I take a case on, for me, it's like putting my detective hat on, because basically I have to go back to basics and try to rule this out and try to rule that out and this and that and the other in such a way that I can try to narrow my differential diagnosis and try to find as much as I can what's the underlying cause. So going back to your problem with the ear, your English Mastiff, it could well be food. It could well be environmental allergies that it could be causing that problem. But until a food trial has been carried out using the specific type of food, which needs to be ideally a protein that your dog has never been exposed to before, an ideal carbohydrate as well that he's never had before, and ideally on top of that it is hydrolyzed to minimize any reactions that the immune system could have to those products. It would be really, really difficult to actually rule out food as an underlying culprit. So again, and I keep going back to the same question, because as much as I would love to help you all, I'm not allowed legally, and certainly not with an ocean between us to help you with your pets. But my best advice is to actually visit with wonderful colleagues that they're the other side of the pond, and most of them, they are very skilled and very knowledgeable, and some of them like me, would definitely like to work on skin cases, on dermatology cases, and I think they will be delighted to help you. My pleasure, Amy. And I think that was the very last question. So if you guys have any other questions, please feel free to ask. I'm not quite sure what situation with Michael.
Hi, guys.
Hey, that's wonderful.
So can you guys hear me?
Hello. Yes, I can hear you fine.
Okay, so we had to switch over from, let me get rid of my old one here.
You sound like you're in the universe now with a lot of echo behind. Does everyone hear the same? But it sounds wonderful. So it's lovely to have you back. We've been doing a little bit of a quick question, quick answer session while we didn't have you on board. So hopefully I'll be able to answer a few questions for our lovely listeners in the meantime.
Just do it from the phone.
Yeah, I've been watching the comments, and I appreciate that you're always so good at taking over. Can you hear me now?
Yes, I can hear you beautifully.
Great. Okay, so yeah, I had to like do everything through my phone, so I'm sitting here through my phone now, and readjusting my studio. God, I tell you guys, this technology, we think it's going to be so easy to work with, and it's not sometimes, and it just drives me absolutely nuts. That here, I've got earphones in, I've got little mic. Anyways, Cristina, thank you so much for doing what you're doing, because like exactly what Christina's talking about, there's so many different ways to look at yeast, and there's so many different avenues to really make sure that you're addressing the right issues and all that. And so I love that you were able just to take the ball and run with it. So let's go ahead and continue our conversation. And now that I'm back on, yeast. There's another technology thing going on. What is that going on there? When we deal with yeast, see, look at this. I'm telling you, this is like...
There is a comment from Amanda, which I think is just spot on. Technology is a blessing and a curse. I couldn't agree more, Amanda. I couldn't agree more. I think this is the current proof that that's the case. But what would we in this world without technology? So, it's part of the deal, isn't it?
So I saw that you answered this question. You started two English masters that has one ear problem always, and found that her food she was allergic to. Yes. Well,
we already had that
too, right?
chat. Yeah. Is we were just saying, obviously, again, there could be another underlying causes, and when we are dealing with ear infections as well, we have to think about that the lining inside the ear is part of the skin per se. So depending on the age of the animal and depending on the clinical presentation or the clinical signs, we must obviously take into consideration as well other potential underlying causes, and that includes obviously ectoparasites, and potential endocrine conditions, immunomediated conditions. So it's a little bit of a kind of cocktail of things that we need to kind of roll out as time goes by whenever we're investigating all these issues. But yeah, my best advice is just to go to your vet, go to a veterinarian, and then obviously they'll assess your lovely English bull mastiff. I don't see them as often as I used to, but they're lovely dogs. And then hopefully your vet will be able to help you.
And when pets get yeast, we see a lot of times that they end up getting these hot spots on their skin. What's your suggestion in like how to like? I know it's not an easy thing to cure necessarily, but it's easy. There's ointments or anything out there that we may be able to use to help remove or help with that issue with the hot spot. What do you recommend?
Well, I mean, with hot spots, there could be. Of course, again, by various issues, and I'm not going to start digging into literature to actually explain why that happened. It could well be just a hot spot due to some kind of traumatic incident that is made that area particularly itchy, and the dog starts scratching it or licking it, and then it becomes infected, and that's the problem. But a way that you can address this pretty quickly is, as soon as it happens, to use an antiseptic product that is designed for dogs. And with this, I have to be quite specific because there are certain products that they are designed for humans. I'm not quite sure what you've got out in the States, but here in the UK, we've got some products that they are designed for human skin that they are a little bit irritant for dog skin. So one of the things that you can potentially look at is chlorhexidine-based shampoos that they're actually kind of sold for dogs, and then chlorhexidine is a natural, it's an antiseptic, and that will obviously kill the bugs that they are sitting on that skin. And if you catch it early enough, and obviously you address the underlying issue from the point of view of discomfort, that could be really, really effective. Once that the infection and the trauma has become a little bit more set on that particular area, then maybe just cleaning it might not be enough. And that's, again, another reason why I would advise you to attend to your clinic or to your hospital whenever you see that things are deteriorating. But initially, if you see it happening, like when they get bitten by an insect, you're seeing, they're in the garden and they get, I don't know, like a wasp sting or something like that. Obviously, ideally remove that if you can see it there, remove the little thorn, but then obviously clean it straight away. So having some chlorhexidine-based product designed for dogs, available for you at home would be really, really handy, because if you start cleaning it straight away, you can prevent a lot of problems.
Beautiful. I just pulled up a question. Should we be aware of the
Yeah.
stresses of the fire on the skin conditions on our animals? This is a perfect one for you, Dr. Cristina. What do you feel? Because like we were at rescues and we saw a lot of these dogs that had been able to escape, and some of them were burned, and some of them, it was really dried skin, their hair was singed and all that. What's the best way about treating these animals that are coming out of the fire right now, that are sitting there? What's your thought about that?
That's a really, really good question, and thank you for asking that, especially with everything that is going on your side at the moment. Well, first of all, I am heartbroken to see the images and what everyone is going through right now in California. So my heart goes to you all, and we are thinking about you. And I mean, we, as a kind of the world, the other side of the pond, but certainly from what I can see from myself, I hope, this is well controlled very quickly, and then we can just put this behind us. But to answer your question, obviously, even if they are not directly affected by the fire, the stress of knowing that there is, a fire nearby, and you have to think about dogs can actually, their sense of smell is 10,000 times stronger than ours, so they can actually detect this much quicker than we could potentially detect this. So if you know that you've got a danger that is coming your way, of course that's going to stress you out. That's going to get the immune system into hard drive, and then just basically working a lot, and that's going to have a knock-on effect on the immune system, because when you obviously your immune system is affected, potentially the body is stressed, that's going to produce high levels of cortisol, and that's going to have a knock-on effect on how well the immune system is going to defend the skin, etc., etc., etc. So that, when it comes to stress, that could of course have a knock-on effect on what the skin is doing at the time. For those that sadly have been affected by the fire itself, and they have had skin being burned, that's a bit more of a complex issue, because like it happens in humans, you've got burns of first, second, and third degree, and depending on the severity, pain relief is very, very important, but also as well using certain types of products that they are designed to help with the skin, from the point of view of preserve the humidity, and obviously preserve or minimize the infection with certain bacteria. Certain anti-inflammatory drugs can be useful as well, but it depends on the severity, because if just basically like it happens to us, it's just like a bit of a, how could I say this, that the hair has just been burned, but it's not really, the skin is not affected. It's a completely different subject, that when the skin has completely been burned throughout, and then you're pretty much at the layer of the muscle, that is basically a hospitalization kind of issue, and that could obviously affect the body many, many different ways, from the point of view of dehydration, and even to put in extremes to organ failure. So if that was the case, and Michael and I were talking about this before we started with the live, we're just absolutely heartbroken to think and hear of all animals that they've been burned, because with humans, at least everyone is aware and try to get them out. But with animals, sometimes they remain in the houses and they can't escape, and that's their end. So again, if you have any personal experience, and if you're worried about your pet, just get your vet to check them over. And at least if they need any treatment, they will be able to provide that for you. Oh, Michael, we lost you again. I can't hear you.
Is there any, you got me now?
Yes. Yes.
Okay. For some reason that one's just not working. Is there any like home remedies that if they, because right now we're seeing like there's like the vets are like so swamped, the centers are so swamped. Is there anything that they can do to help at home with maybe something they have at home right now while maybe they're trying to get to the vet or get into the vets?
Absolutely. One of the things that you can use and is quite safe for the skin is organic aloe vera. Okay, there are certain products that they're produced for animals. Aloe vera in general is aloe vera. It needs to be as purified as possible, 99% organic and without any preservatives, as much as SLS and all those others that could potentially be irritant to the skin. But I think, again, I'll go back to where we were talking about before. If it's just the hair, no big deal. If the moment that the skin is affected, yes, by all means, you can start using aloe vera while you're getting an appointment with your veterinarian. But if it's obviously something more severe than just a little bit of a charred hair, it needs to be assessed as soon as possible. And if you call your vets, your hospital, your clinic, and explain exactly what happened, they're going to tell you to come in as an emergency, and they will fit you in somehow. So don't hesitate to call your vets if you're worried about this, because it's always better to act on the cautious side than potentially wait to see how things develop, because it's that waiting period, those 24, 48 hours, that could actually make a big difference to the prognosis in the long term.
Nice. What about, I mean, what would you suggest for people like in my area that's living here in Los Angeles as maybe like some sort of simple little toolkit that we could put together just in case we're driving down the highway? Because I'm sure this is going to be happening over and over and over. There's probably pets out there that have not been found, that are hiding out, that are nervous, and slowly they're going to be coming out of wherever they're hiding. And all of a sudden they're going to come to the streets, and all of a sudden they could be burned and they could have us think, what would be a good little like simple like kit that we can build here and like in a duffel bag that we should have in our car just in case we come across one of these pets?
That's a great question, Michael. If these pets obviously have been, family pets, hopefully you'll be able to approach them quite easily, and they will be used to humans. They won't necessarily run away from you. So one of the things that you can include in your little duffel bag whenever you're in the car is a slip lid. I don't know if you guys know what I'm talking about. Is a lead. Sorry, the computer is wobbly because I moved to the stairs just to make sure it wasn't like signal, because in my room is a little bit more difficult. But basically, a slip lead is basically a lead is designed for dogs that it doesn't have a collar. It's literally like a continuous lead, and it does have a ring at the end. So basically, that ring actually helps to put the end of the other lead around, and it's a little bit like a tie, like a gentleman's tie. So whenever you use it, you can actually put the head of the animal within that ring, and then you've got obviously an end that you can take the dog with you. And the good thing about it is that you've got good control without having to put a collar on, which obviously would be more difficult. You've got a dog that is not keen in being examined at the time. So sleep lead is a very important thing. Second, something that you can do, I would advise you to have something that you can obviously create a quick muzzle, something that we call a tape muzzle. So you can have like a piece of gauze that is long enough, and then actually create like a knot and put it around the muzzle. Because what you have to think about is when animals are scared, or potentially if they're in pain, they might react in an undesirable way. So they might become, I wouldn't say aggressive towards you, but obviously they are in pain, they're scared, and they've got someone who doesn't know, or they don't know who that is. That although there are really good intentions behind that, potentially they might feel that you're also trying to hurt them. So in doubt, and as long as it's always safe for you, which is very, very important to remember, there's another thing that you can do. Just put this little tape muzzle. You can Google it, guys. It's quite straightforward to do. And that will give you another extra layer of protection where you're trying to put the lead on. And then again, obviously, if that's not necessary because your dog is allowing you, or that dog is allowing you to do it, always have water with you in the car and a dog bowl, so you can potentially give that dog water straight away. You have to think about if they've been in the fire, they've been in a very hot environment. they will be dehydrated and they will be desperate for water. And certainly you've got everything that has been burned around. It's not going to be easy for them to find it. So this is a very simple thing that you can have, just a bottle of water in your car, and then obviously a bowl, a collapsible bowl, a travel bowl, and then just let them drink. Let them drink, let them drink, let them drink. And they even allow you to do anything else. You can pour a little bit of water over the area that is obviously being affected, so you can clean that area and trying to cover it with a towel and keep it moist. And a towel or a sheet of some kind that is obviously clean is also an important thing that I would normally tend to take in my car. So you can cover that area and then obviously drive them to the vet as soon as you can.
Nice. And going back to the vet, let's say we get to the vet and the vet, like, you know, there's so many vets right now, they're taking in so many pets, they're so busy.
Yeah.
And let's say we find a dog that's not in dire need of like help from what we can tell. Is it safe to bring them home, and is it safe to like maybe like give them a really cool bath and kind of like let them, you know, rinse off, or is that going to aggravate anything, or do you think that's safe to do with them?
It really depends again on the severity of the lesions, because if basically what it looks is like the coat is quite dirty, you know, full of kind of, you know, this dust that you normally tend to find when things are burned around, this kind of very fine scaly bits, but the dog is friendly and is allowing you to do it, and you actually giving them some water and you give them some food and you allow them to rest, and you feel that the dog is still bright and basically doesn't show any signs of any obvious injuries, as long as that's the case. And obviously once that you've contacted the veterinarians and they say, look, we're flooded today, but the dog seems to be doing well, maybe pop in tomorrow. Yes, potentially you can do that, as long as you're not putting in any kind of danger. I think sometimes we want to do a lot of things, and when other animals are scared, we don't know how they're going to react. Saying that, sometimes when we are in that position and they actually find themselves in a loving home, and then they kind of relax a little bit because they're no longer in danger, they will allow you to kind of establish a rapport and obviously a bit of a bond. But it's important that you actually judge as well what their behavior is, because once that you get them in the bathtub, maybe they've never been bathed before, and then you're putting them on another extra stress of being washed with a shower, and then you're trying to do it because you think it's a nice thing to be clean. By the other hand, that dog might never have had a bath before, and then you put in an extra layer of stress, and they might not necessarily be very receptive to that particular treatment at that point in time. So I think it really depends on the case. You can't really say there is a black or white rule for every occasion, but yeah, that would be my best advice.
So basically really just kind of follow your instincts and just kind of feel the situation out.
Exactly.
So basically have a nice loose leash that you can slip over their head, maybe a blanket, some water, maybe a little food of some sort, just as a little emergency kit, just to be able to help these pets at this time. Let's get back to yeast, okay? So allergies, what I've seen is allergy plays a big part in the yeast. Why is that?
Allergy plays a big part in the yeast because whenever you've got allergies, the skin becomes inflamed. And when the skin becomes inflamed, that actually is a perfect ground for yeast to grow. So realistically, basically the drive between, so the drive to actually find what's the underlying cause of this potential issue with the yeasty overgrowth is trying to prevent the inflammation of the skin in the first place, and obviously trying to minimize the chances for the yeast to actually grow back in there. So this is the reason why, you know, we try to obviously address this problem as best as we can. In addition to that, if we find that your animal has suffered or is suffering from a condition called atopic dermatitis, which basically tends to include everything to do with environmental allergies, you find that most of these animals have, to a degree, less strong skin barrier. And then consequently, because the skin barrier is not as strong as a healthy animal per se that doesn't suffer from skin issues, that again is going to kind of contribute to some changes in the skin flora, and potentially to the dehydration of the skin, because the skin loses water from the inside out. And when the skin is not super tight, that could obviously make the skin a little bit dehydrated, and that could obviously contribute as well to the yeasty overgrowth. So when we are dealing with allergic skin disease, we use what we call a multimodal approach. So we're just not dealing with inflammation, we also deal with the skin barrier, and then obviously other things that we need to take into consideration to prevent flare-ups as much as possible.
Beautiful. So once again, everybody that's in chat right now, if you have any questions for Dr. Cristina, please put them in the comments below. We're here. We have this incredible talent in front of us. She's been one of my favorite ladies here. While we, if people want to ask some questions, let's go ahead and dive into some questions. But I want to go ahead and go back to one of my favorite things about Dr. Cristina is she has this book, and it's called How to Be, what it's called the New Pet Parent book, right?
That's correct. Yes, the New Pet Parent book.
And so, Dr. Cristina, you were without a dog at the time, weren't you, when you first started this book? Or
well,
how did the book? Yeah.
Well, I actually wrote the book just before the pandemic. So I started writing in 2018, and it took me all the way to the end of 2019, and we were planning to launch it just in January 2020, and then COVID happened, and obviously they had to be delayed. But the book actually is based on my own experience as a kind of dog pet parent, or a dog parent, if you want to call it that way, or dog guardian, and obviously my experience as a veterinarian as well, because believe it or not, I never had a dog when I was a child living at home, and I only got my first dog when I was actually a baby vet, when it was my first year in practice. So it was quite an interesting experience having the opportunity to become a dog guardian in my first year of becoming a veterinarian per se and working in practice. She taught me a lot, because I knew all the theory, and obviously I was working with dogs at the time in the clinic, but obviously working with them and knowing the theory is a different experience of owning a dog or looking after a dog, and then obviously seeing all this, oh, thank you, Michael, and seeing all this happening, firsthand. So yeah, it was an adventure for both of us. She actually became my best friend, and she made me a better veterinarian. I will forever be grateful to my little girl for helping me to grow, not as a professional, but also as a person. And it was a privilege to have the opportunity to share my life with her. So when I made a decision that I wanted to write a book and tried to help as many people as I could, giving them advice, very simple advice, like we've just done, in this kind of quick fire questions session. I wrote the book with her in mind as a dog parent or as a dog guardian versus a vet only. And basically it's just me talking like I'm talking to you in a book. So if you guys are interested, it's very, very simple to read, is in a very simple language, and hopefully quite, it's only a little book, so it's not that big. But yeah, if you're interested, feel free to have a look and see what your thoughts are, and just get yourself a copy. And I truly, truly hope that it can help you, even if it's just by one little piece of advice, and help you feeling that you can look after your dog as best as you can.
Well, I remember when we first talking, during the pandemic, we were talking about the book, and we actually were taking chapter to chapter, and we actually broke it down on Clubhouse. And like what you said, it's like, the book is filled with so much information. There's so many key issues in there that happens every day. And some of the information is so wise, and it's so simple that, when we have a pet and we're, in the midst of everything we're doing every day, to have a guide like this, I always say, we want to have a toolbox for your pet. And so this is a perfect, toolbox additive for your toolbox, just so that you can refer to it, because it talks everything about, from, when do you get them, neutered, or, all these questions we may have in the back of our heads that we just don't have a vet right at our hand to say, hey, what about this? What about this? This book actually, really covers a lot of the everyday life cycle of a pet. And I think it's beautiful that you've, created it. And, that's one thing that interested in, bringing back to this show is actually bring back, breaking down your book and just giving these simple little tips every single day of like, what can I do here? I just got a new pet. I've never had a pet before. And it just really, really breaks down that, you guys. Here, Amanda's asking, is there a cat version? Is there a cat version, or would you kind of say that this kind of book is kind of like it embodies cats as well? What's your thought about that?
Well, I think some of the advice that I obviously offered in the book can be translated into looking after cats by all means. Obviously, we're talking about different types of vaccinations in the book and some of the bits and bobs that are specific to dogs. But I think there's a lot of advice that it could be passed on, from the point of view of looking after a cat as well. Answering your specific question, Amanda, yes, there is a cat version, in the pipeline. It hasn't really materialized just yet because my life has gone through ups and downs in the last few years. So it's in the pipeline, and at some point in the near future, it will be available. But at the moment, it's not published yet. So by all means, we'll let you know whenever that happens. And of course, Michael, you'll be the first person to know, because there will be a lot of cat people that hopefully, will be looking for a little bit of help as well. And even if I can help just one person, for me, that's more than enough. But yeah. It will come in the future, hopefully.
Yeah, well, it definitely, when I hear about it, you guys will hear about it for sure. Now, just everybody, we're talking with Cristina. She's in Liverpool. What time is it there right now, Dr. Cristina?
I think it must be, let me just check. It's actually 8:20 in the evening.
Okay, so not too late. That's great. Okay. Yeah, because I always like to be conscious of your time and, you're, being here with us. To going back, let's wrap this up in the sense of like yeast. My dog's got yeast. We've got this issue going on. We thank God we have a formula that helps with yeast now with pets, and it's for dogs and cats. A lot of people think for some reason when they see our product, they think it's only dog, no, it's dog and cats. All our formula works for dogs and cats. And it's, the Yucky fungus here. This is the one that we recommend for yeast. And we also recommend the one that is called Itchy Scratchy. And for me, it's like, as long as we're helping one pet, two pets, the more we can help out there, that's my goal with what we do here. I never thought I was going to be in this pet world like I am today. And now I'm so deep in this pet world, I just can't imagine me not being in the pet world. I love what we're doing. And I heard that, we've been talking about this for a while. You're like, our products are not available there in the UK right now, but I think we're in the process in the next few months that we're actually going to be opening up to Australia. I have someone that's so interested in Australia, us being in Australia.
Fabulous.
So we have a lot of demand outside of the United States. It's, it's just, getting through the paperwork and, making sure all the documents and everything that we get, processed correctly. But it looks like we're going to be, hopefully within the next couple of months, we will be in your area. We'll be in, throughout Europe and also Canada and Australia. So we are working on that. And we are trying to get some, and when we do get a person that has a need that, really wants our product, we do kind of go above and beyond, and we'll actually take the product to the post office and fill out the forms that we have to fill out there, and we will get it there. And we're working with someone right now in Australia. I'm just finalizing the documents that I need to get, and then we'll be able to get it to them. But it's a longer process, but we can do it. But I just want to let everybody know that we are working on the international connection, and it seems like it's going to be pretty simple, but I always shy away from that pretty simple thing, because I'm the first one. It's easy. And then all of a sudden you get into it and you're like, what is this? It's not easy. It's all these different levels. So we will be bringing it there.
Bureaucracy. Yeah,
it
that's
is.
Right.
It really is. In closing, is there anything that you want to share with pet parents, about how you're, like, let's say that you're a pet, Dr. Cristina, and you have yeast and your pet parent doesn't know that you have yeast. What would you say to them on how you really feel right now with having this internal problem?
Okay, so I think possibly one of the things that I want to kind of bring across is that dogs and cats can talk to us. So they're going to be showing us in their own way that they're uncomfortable. And one of the things that they do for that is that they actually lick themselves or they scratch themselves. And generally speaking, that happens because they're itchy. So from that moment onwards, you also have to pay attention to what other clues are giving us with this problem. That the skin gets red, that the skin gets inflamed, you get this funky smell that you don't quite know what it is. You come home thinking, smells weird, and I don't know what that's causing it. It could well be your pet. So if that's the case, it's actually trying to start picking up these little signs of, do we have a problem? Is this just a habit, or is there a reason why my pet is doing this? I'm talking about pets, and then the same thing applies to cats, of course. But, we have to understand how to read them, because they are giving us clues, but they can't tell us, in black and white, like when you go to your doctor and say, your hurts here, I'm itchy ear, they're kind of telling us in their own little ways. So I think as a pet parent, our duty is to actually get to know how our pets speak to us, and they tell us that they are uncomfortable, that they're itchy, that they're potentially in pain, and I think as soon as you pick all these little clues, then have the opportunity to say, okay, what do I have available, and what do I need to do whenever that happens? And as we said before, we have to think about, Michael actually works with an amazing herbal master, knows his herbs and all his other kind of medicinal tools in detail, and they've created wonderful products that it could be really useful in managing these chronic skin conditions. But I think what we need to do as well is trying to identify what's causing this in the first place, and that's why we guys, and I'm talking about us veterinarians, can actually help to try to determine the underlying cause, because apart from obviously fixing the outside, we need to try to fix the inside. And I think that's in essence pretty much what I'm trying to say, that learn how to read your pet, because you will get to know them so well that you can read them inside out as much as they know you. And I think you'll see, once that you start addressing the problem, suddenly they're going to be much happier, and this pruritus and this itchiness is going to resolve, and the skin is not going to be red anymore, and they're going to be happier, and the skin is not going to be smelly. So overall, just kind of try to remember this message from this live, and then try to pick up on those little things, and hopefully you'll be able to help your pet a lot.
And we do have, I'm going to see if I can load one more thing really quick before we leave here. Let's see if I can get it here. Let's go here. Let's go here. Dr. Kyle just recently did us a favor, and he's been doing a lot of YouTubes for us and videos for us. And so I want to see if I could find one. Let's see if I could find Dr. Kyle here. Let's see here. And I want to see if I could find the one for yeast, since we're on it, and then take it from there. Let's see here, right here, there's anxiety.
Dr. Kyle is extremely knowledgeable. I would love to be able to get in his brain and pick up this little information that I could use as well. But hopefully once that Michael's products arrive to Europe, and particularly in the UK, this will be a great tool for us as well to use in this chronic skin condition. So that would be really great.
Okay, I think I've got it loaded here. Let me see if I can bring it up here. Let's go ahead. Let's go. I'm telling you, this technology threw me for a loop today. Oh my God. Let's see. Settings, share screen. Let's go here. Share screen. Let's go here. Okay. Share. Can you guys see this one?
Oh, corn chips. I never thought about that one. Well, I guess it's the same as popcorn that one of my clients was telling me about. So there we go. That's an itchy dog. Kills yeast naturally. Excellent.
Do we hear volumes? Do you guys hear volumes?
No, I can't hear anything, but we are seeing the lovely pictures. So
yeah, I don't, for some reason, once again, I don't hear the volume on this. I don't know why. I hear it.
Without being hard on the liver.
Is that better?
Oh, yes, we can hear now.
It's easy to use.
Here, let's start over.
Measure and add to their food. If they're picky eaters, use the syringe directly in their mouth. Tackle fungus the natural way, because your pet deserves relief.
Oh, our dear Frenchies, eh?
I know, right? Let's get this one off now. Okay. Now we've got about an echo. You hear echo now?
I can hear a beautiful echo for sure.
Are you trying different supplements, maybe topical creams or treatments?
Oh, that's Dr. Katie.
Yeah, I was about to say, sounds like her.
Yeah, I'm gonna have her on our show here soon. Why am I
Great.
echoing? Okay.
Well, definitely the StreamYard is putting through your paces tonight.
I'm telling you, it's ready. I'm ready to, jump off and go for a hike. I think. I wish I could.
Yeah.
Anyways, okay. So we were able to see that. So we do have these videos, and these videos I'm going to be launching onto our on the Pets Journey as well, so you can watch all these different videos. I want to give a big shout out to everybody that joined us today, and anybody that sees this after the fact. Please feel free to reach out to us anytime. If your pet has yeast, we have a solution. We can point you in the right direction and walk you through baby steps on how to make your pet happier and healthier today. I want to thank our special guest here today, Dr. Cristina from Liverpool. I adore you. Thank you for jumping on today, and we'll be doing many more of these together. If you guys are interested, please be sure to hit the like button on the journey, the Michael the Pet's Journey, so that you guys could always catch the latest stream coming on. I've got a couple coming up this week that are just going to be even more in depth in different areas. One's psychic, one's just all holistic natural well-being for pets. So let's give our best to the pets. They deserve the best, just like we deserve the best. So with that, absolutely. Dr. Cristina, thank you so much to jump on today. I really appreciate it. I love seeing you. I can't wait to see you again. And we will be catching up again here shortly. Everybody, thank you so much for being here today. I really appreciate you, Amanda, for taking care of the chat today and taking care of all the links. And until we do our next one, which is coming up here, I believe this week, circle around with me, you guys, if you guys have any comments, anything you want to hear more of, or if your dog or cat's going through anything specific, arthritis or anything like that, let me know, and I'll be happy to bring on an expert and we can break it down for you so that maybe you can learn something that you could be doing differently for your pet today. With that, I'm Michael. I'm out. Dr. Cristina, much love, much peace.
Thank you. Thank you for having me. It's been a real pleasure.
All right, doll. And everybody be sure, if you don't have the new pet parent book, grab it. It's like a little Bible to have next to your bed just to look into, because you may find something there that you didn't even think of. And it's those little things sometimes that makes the biggest difference. Okay, guys, have a beautiful day. Bye.